Let's go around. Tara Murphy, good morning. How are you? Please
Hi.
just give us your name and where you're from.
Yes, I'm Tara Murphy. I'm from Albany, New York, and I've worked in home care for 22 years now.
Wow, thank you. Thank you so much. I feel like saying to you, thank you for your service. Brian, I see you in my box here. Brian Kravitz.
Hi,
Come
I'm
on,
Brian
Brian.
Kravitz. I'm the Executive Director of Search and Care, and I'm so glad everybody's joining us today.
Thanks so much. Shelley Gardner, hi, how are you?
Hey, good morning. Thank you for the invitation. My name is Reverend Shelley Gardner, and I am the chaplain for the Jarvie program through the Presbyterian Foundation, as well as provide the administrative oversight of the grants to organizations, of which Search and Care has been receiving for, I don't know, Brian could probably tell me better, but for many, many years, probably the longest.
Many years, without a doubt, and with much gratitude.
Thank you, Brian. Glad to be here.
Loretta Copeland, good morning.
Good morning. This is Loretta Copeland from East Harlem, and I am a person who is in need of care, and I have worked in the caring field most of my life.
A wonderful advocate. We are so privileged to know you, Ms. Copeland. Thank you for being here today. Zachary Hilty, good morning.
Good morning. My name is Zach. I live in Ulster County. I'm an individual who requires home care, as well as work with the New York Association on Independent Living, trying to spring people from nursing home care as a peer advocate.
That's awesome. And I wanted to say that one of the outcomes of lack of home care is possibly forcing people into nursing home prematurely, unnecessarily. They could have been at home if they had the proper care. We also see, let's see who's here. Oh, good morning. Okay. Good morning, Karen. Barbara Russell, good morning.
Hi, Robin. Sorry about that.
That's okay, Karen. Good
Hi.
morning.
I could join you. I'm in transit on my way to a meeting, so I wanted to come on, but I'm not able to join via video. But thank you for inviting us as always, and we're so happy to, be partners with you on a lot of different things. So thank you.
We're always happy to have Jarvie Services join us. Thank you. Barbara Russell, good morning. Okay, Barbara. Irene Freeland, good morning. You know you from Project Find. Okay, let's get back to Joseph now and our workshop for the day, please.
Okay, did everyone introduce themselves? My internet knocked out, so.
Yes, well, glad you're with us, Joe.
I'm back. Thank you, Spectrum. Okay, so let me share my screen. Oh, now I'm not a host anymore. Jacob, can you make me a host?
You should be good.
He is.
There we go, awesome. Okay, so as we all know, this workshop is about fair pay for home care. I labeled it Can't Find Home Care, Why a Case for Fair Pay in New York State. And just to share, this will be focused particularly with the aging focus and with the focus on New York State. Of course, this issue happens in every state and across the globe, but the focus for this, the purposes of this presentation will be for New York State. First and foremost, there's just not enough home care workers, and you'll see why. In New York State, annually, we need an average of almost 26,000 new aides to keep up with growing demand, and an additional 71,000 to replace aides that leave annually. A 2008 study shared 40 to 60% of home care workers leave after less than 1 year, and 80 to 90 leave within the first 2 years. So you might be thinking, well, why is that the case, right? And this is not something that I believe in. but I think that this academic Osterman said it best. Aides are the stepchild of healthcare, right? I think that they're under recognized in the healthcare industry and in the infrastructure, even though they're a vital part of it, right? So, and if we just think about it from the COVID-19 perspective, right, home care workers did not receive the same recognition as other essential workers like doctors and nurses, even though they were, right, still working, still going out, and still risking themselves, right? And in New York State, 45% live in or near the poverty line, and 51% rely on public assistance. In New York City specifically, 1 in 7 low-wage workers is a home care worker. Now, thinking about the pay, right, how does this impact the industry? Well, a 2004 report shared that turnover cost between 900 to 5,000 per employee. So averaging about 2,000, and adjusted for inflation, that's almost $4,000 in 2020 dollars. So that's not even including the inflation we're experiencing right now. So it's probably even higher. Of course, this is a big deal, right? Because we need the care. We all need care, and we will eventually need more care. 2 in 3 people 65 plus will need some form of long-term care at some point in their lives. And over 90% would prefer in-home-based care instead of institutional care. And in 2019, 20% of positions were unfilled, and 25% of patients reported an inability to find home health aid. And of course, as you would imagine, during COVID, this was worse. And in New York City specifically, the older adult population is projected to grow exponentially. Long-term care is expensive, right, as the alternative. According to this report by the American Healthcare Association, Medicaid reimbursement rates were $243 per resident per day, so that's every day. But the actual cost of providing care was $307, resulting in a shortfall of $64 per resident. And as you know, as with many reimbursements rates, they never cover the actual full cost of what it takes to administer the service. That's just, it seems that's the way it's going, right? Or it's always been. And compounded, this adds up to $1.5 billion shortfall for the state. So you're already starting to get the picture, right? There's a shortage in aides. Why, right? Because the poor wage setup. Many people need the care, and the population is growing, and they want in-home care, as well as the long-term care in an institutional setting is incredibly expensive. Of course, some people might be thinking, well, what about caregivers, right? Unpaid caregivers in particular. 10% of family caregivers leave the workforce in order to provide care at some point in their careers, which, as you would imagine, this means that they're no longer able to contribute to the local economy if they're being an unpaid caregiver, right? Because now they had to leave their job and care for this person. But the other issue is the available pool of caregivers is shrinking. So they use the ratio 45 to 64. So I guess they're using that to say these are generally working age people compared to 80 plus, which is generally people that may need more assistance. And that ratio is shrinking. So for every 7 in 2010, now there's only 4 in 2030. So the amount of people that are working age and that would be considered caregiving age, right, is shrinking compared to the people that need the support. So if nothing changes between 2016 and 2030, the supply of paid home care aid will grow by 6%, while the population 65 plus will grow 50%. So you see it's highly uneven. And as I mentioned earlier, COVID made this all worse. In an October 2020 survey, 85% of participating New York State home care agencies reported worsening staff shortages. And 76% of the agencies surveyed were forced to delay acceptance or deny them entirely. And for those of you that don't know, ISEP is an additional home care program. Most people are familiar with Medicaid and CDPAP. ISEP is a smaller program that provides up to 20 hours a week. I don't believe every state has it, but New York State does. And that program as well, like Medicaid, also is experiencing shortages. As of February 2021, almost 3,000 older New Yorkers were on the wait list. And this study shared that they would need to recruit between 700 and 1,000 new home care workers to meet this demand. And again, this is just speaking about those that are on the waiting list. It is unclear about those that are off the waiting list but have not yet received an aid or are not receiving the hours that they need, right? And some of the care receivers that are on the call later on will share their experiences and they can attest to some of the challenges. So now you might be thinking, well, what would be the fair pay? So the purpose of this presentation is not only just to raise awareness of the issue, but provide some sort of call to action to everyone. And what we are advocating, and when I say we, I'm talking about home care advocates, particularly those in the caring majority, which I'll explain a little bit more about later. We're advocating for the Fair Pay for Home Care bill, which would raise home care wages 150% of the regional minimum wage. So again, regional minimum wage, so meaning in New York City, it would be different than Long Island, Nassau County, and upstate New York. In New York City, it would probably go up to around $22 an hour. And maybe some of the people on the call that live upstate will be able to share what that would be upstate. But that's what we are advocating for because we think that that would provide enough money to get over the benefits and entitlements cliff and still provide enough meaningful wages, right? Because you can increase the wage, but then once you hit the benefits and entitlements cliff, which is essentially you're no longer eligible for, let's say, SNAP or a different service, you might actually be in a shortfall. So raising the wage not in a meaningful way or not in a thoughtful way actually can have an adverse impact. So that's why we're saying at least 150% of the regional minimum wage. Of course, some of you, which is a big $1 million question, right? They're thinking, well, how are we going to afford this? And in fact, we can afford this and it would be beneficial for the economy. Turnover would fall by an estimated 31% and would save about $151 million per year. It is projected to fill 20,000 direct care jobs annually and create 18,000 additional jobs in other sectors through increased economic activity and generate approximately $5.4 billion for the state's economy. So you often hear the where's the money, how is this going to happen? Everything is pointing that fair pay for home care is the right decision, and it's not only just in a human rights perspective, right, for these people, but also it would be beneficial for the economy, and we can afford it, right? I just wanted to share some other things. For one, the New York State Office for Aging, I received this mission statement from I believe it was the comptroller's office that is doing a review, and it included the mission. And basically, the New York State Office of Aging has an incentive to support this because, as you see, one of the things that their mission says is that they're supposed to advocate for cost-effective policies. And as you see, this would generate a lot of money for the state and save money on turnover. So it is a cost-effective policy, and the Office for Aging should have an incentive for supporting. And of course, I'm going to include some information for social workers, as many of you are social workers. We also have an obligation to support this issue and this movement, and it includes care managers as well. There's also a care manager's code of ethics, and it also includes engaging in social and political action as well. But this is from the general code of ethics. And for those of you that might be thinking, well, there was the governor who just provided these raises, and what does that mean? As I mentioned earlier, not having a thoughtful or meaningful wage can have an adverse reaction. Just to share what it was, so for those of you that don't know, the governor did propose a $3 raise over a 2-year period. I believe it would be split. I think it was $2 the first year and $1 the other year. And I also believe it's a little bit different from New York City to upstate, and maybe some of the upstate people can clarify that. One of the good things, I guess, is that it is raised. It's indexed to the minimum wage, meaning that anytime the minimum wage changes, it also goes up along with it. But again, the challenge is this a thoughtful and meaningful wage increase? And given that many home care workers rely on government benefits and entitlements, will this actually result in a shortfall? I hope not, but it is likely. And I think myself and some of the other advocates on the call will be looking closely at this. And we'll see how the impact, what the impact is. And I just wanted to share this as an example. So let me open this up. Okay, can everyone see this screen that I switched to?
Mm-hmm.
Okay. So this is a study. Let's see what the study is. So it's from the Urban Institute Benefit Split Study. And this study essentially tried to show what it would look like with an increase and a decrease. I actually had tried to calculate this myself. And honestly, it requires someone much more skilled and smarter than I am to do this, because there's just so many factors that go into benefits and entitlements, right? Just because you're no longer eligible, or per se, if you are eligible, not everyone's circumstance is the same, because they're including, expenses like rent and other things and medical expenses. So someone per se that's making the same amount as someone else may not even be receiving the same amount of benefits because of their expenses. So it's a very interesting song and dance that goes into it. But I did find this study that went into it, and I think kind of shares the picture really well. So as you can see, for New York, how benefits and taxes change when families earn $2,000.
Oh, Joseph, so sorry. I don't think it's actually showing on screen for us, the actual survey itself. I mean, if someone can confirm that.
Let me see.
Yes, the slides are not advancing. So sorry.
Okay, well, okay. How about this? This is what I need to show. You see this little chart thing?
Mm-hmm.
Okay. Love Zoom, right? Yeah, so this is the chart, and it's basically showing when they're earning a certain amount and they're losing the benefits and tax credits, where there's a shortfall or not. So you could see the orange is where is the most ideal. They're keeping all their earnings and may still receive benefits and tax credits. So you could see where the orange is, right, in the different sections. And again, this is if they're earning 2,300 or more. And then if you see for 7,000 or more, you can see the difference in the orange, right? I figured I would show this chart because it kind of demonstrates that a little bit. So this is the 7,000 or more. This is the 2,300 or more. So it's a very delicate song and dance, and I think that people really have to look at this in a meaningful way when you're working with this this population. Right? Let me go back to the slide. So now you're probably all thinking, well, what can we do? You gave us all this great information and great details. What can we do? One thing I would say is if you're an older adult or you have clients that are older adults, encourage them to join our advocacy program. One of the issues we work on is fair pay for home care. We also work on voter engagement, as well as an East Harlem COVID-19 study for older adults. And actually someone from our advocacy program, Loretta Copeland, will also share some of her experiences. I would say more importantly, join the Caring Majority, which we are a part of. It's a giant coalition across the state of primarily directly impacted people. So people with disabilities, older adults, and home care workers, as well as caregivers. So it's a giant coalition. It's been very successful. I would say the Caring Majority is probably the reason that home care workers even received the recognition they did and received the $3 increase because of the amazing advocacy that the Caring Majority did. And of course, some of the people that are on here can even share some of the advocacy they did in Albany. And also, I believe the Caring Majority was involved in the last governor's debate, if those of you have watched it or not, but they did bring up the home care shortage as one of the issues, which I was so shocked when I heard that. But I believe Caring Majority members advocated for that to be included in the governor's debate. I would say again, educate yourself and others about the issue. Encourage directly impacted individuals to publicly share their story. So that could mean sharing other people, that could mean on social media, that could mean contacting, news outlets or editorials. And I think that it's important to share that you don't have to, be someone that's ambulatory or anything, right? You can be a homebound individual and you can still have your voice heard, right? And share your story and your experience. I would say contact your state legislators and particularly the governor, who seems to hold the most power in all of this. For those of you that were not familiar with everything that was going on with Fair Pay for Home Care, the individual chambers released their own individual budgets, as well as the governor, and both chambers, the Senate and the Assembly, included Fair Pay for Home Care in their individual budget proposals. But of course, the governor has the most say and strength in getting the final budget proposed. So there was the $3 increase, but not the full Fair Pay for Home Care. But as you see, we have been making a lot of traction with the state legislators, and they've been seeing that this is an issue and it's an issue they can no longer ignore. And you can call them, you can email them, you can write them, which I think is very effective. Snail mail, emails, everyone gets blasted with them, but when you send something snail mail to somebody, it stands out. Social media, that's actually another really effective mobilizing tool. It seems in particular Twitter is the new organizing tool because you can tweet at them, you can get things as they're coming. I know the Caring Majority, we were getting information as it was like being, developed in the rooms when they were talking about the budget, right? Because people were tweeting it out. So you can get things like minute to minute. And it's a good way to really get the attention of legislators and tweet at them. I'm not really a social media person, but I specifically created a Twitter just for Fair Pay for Home Care. So that's what I use it for. And in person, I know that's a little bit more difficult with COVID, and depending on people's limitations. But if you are able to, you can attend different in-person rallies. Something that the caring majority members did was bird dogging, which is basically a technique where you find out where key players are going to be, whether or not it's home care related or not, and somebody shows up there and confronts them and say, do you support fair pay for home care? It's a way to kind of show that the movement is everywhere, right? That wherever you go, there's going to be a fair pay for home care advocate somewhere watching you. And it's a little bit of a way to kind of catch them a little off guard to see what they're going to say about something, right? Because of course, when you have something that's scripted, you're going to get the scripted, that's something that's prepared, you're going to get the scripted message, right? But most importantly, I just want to say one thing we really need is cultural change. As I mentioned earlier, home care workers did not receive the same recognition as, doctors, nurses, but yet they were essential workers nonetheless. And they were essential even before COVID, and they are going to be after COVID, right? And this person said it best. The first step is the first step is seeing it not just as valuable labor, but as labor in the first place. And I think that speaks volumes about what it means to be a caregiver, what it means to be a home care worker. I just think it's such an invaluable labor, but it's not seen as that in the public perception. And you can also just see it when you hear people talking about childcare, the conversation is much different than when it comes to older adults and people with disabilities, right? I think there's room for both, right? And these are my sources. I just wanted to hand this over to some of the people on here to share their experiences, and then after that we'll leave room to some questions. So maybe let's start with Miss Copeland, and then we could go to Zach, and then we'll finish off with the best, our home care worker. So Miss Copeland, are you still there?
Yes.
Okay, so you can share a little bit about your experience and including why home care is important to you, why fair pay is important to you.
I'm home because of my heart and because of strokes. And I have a lot of other medical problems. I just experienced over the last 3 weeks home care. I had 2 days, I was supposed to have 5. I had a woman come in and said she would do the other 3 days. After 2 days, she said, oh, I need more time. She couldn't get the time, so she went to do security work. These are the things that we have to go through when we're looking for home care. I don't want to go in a home. I told my children I don't want to go into a home. I've been in homes visiting a lot through my life, and I just knew I cannot survive in a home. I want to be in my own house where I can look out the window, I can walk from one room to the other, I can go downstairs when I want to, I can eat when I want to. These are the things that keep us in the community and keep us working with the people in the community, keep us alive. That's what I want to do. I do not want to sit and look out the window for the rest of my life, or sit in the hallway and watch everybody else go past. we need to really get people to understand that this world is bringing in people that are older. They are living longer. They are living in their 90s and their hundreds. You don't have enough home cares to even home places to put them in. Let them stay in their homes where they can be in the community and where they can be able to talk, where they can be able to live a normal, decent life. And that's what I'm looking for. At 82, I feel like I deserve that. I have worked all of my life, and now that I can't do it, I want to be able to be in my house and just live the best I can while I'm still here. I've had so many doctors tell me, oh, you're not going to be here, you're not going to be able to do this. And I'm still here. But I'm here because I'm pushing. I'm still fighting for the person that can't get out there and talk for themselves. I have gone into nursing homes where they just sit and they have no kind of life. They got to sit in a cafeteria. I don't want that for myself. I don't want that for anybody if they can stay in their apartments. So that is what I'm fighting so hard for. And no matter how I feel, I have been to the rally and the next day been in the hospital for congestive heart failure. But I still feel like I have to fight for this, for the older people that cannot do it for themselves. So that's what I'm keep asking y'all to keep pushing. I talk to everybody all the time about care, getting better paid for our home care service people, knowing that when they come through the door, they got to smile, they keep us company because we by ourselves a lot of the time. So it works out for us to at least have them coming in and we at least seeing people and we doing stuff with people. So that's what I'm fighting for.
Thank you, Loretta. Zach, do you want to share a little bit?
I would absolutely love to. So I've been working with the Caring Majority from its inception. My home care worker, Lolly, and I were talking at a press conference back when our not so illustrious Governor Cuomo was trying to kill the consumer directed personal assistance program, which allows me to hire, fire, train, and retain my aides in a way that I can do because traditional home care doesn't work. They're not allowed to drive me to appointments. They're not allowed to do certain medical procedures. So Julia Salo approached us and we've been hooked ever since. To a couple of Joseph's points, in New York City, the minimum wage is $15 an hour. Fair pay would make that $30 an hour. In upstate New York, where I live and my comrade Tara lives, it will go to $22.50 an hour. The part about the benefits cliff, as you said, Joseph, would push many home care workers over that cliff, causing them to either cut back hours, leaving folks like myself in a lurch, or they will go to fast food, which pays $15 an hour, which is going to bring me also to my work. As you said, it's impossible to find home care workers. It's impossible to find places for folks like Loretta to live without the support that they need. So it makes my job very difficult to speak with folks in a nursing home, and to speak to Loretta's point, they have no quality of life. COVID has racked the nursing homes. The food is terrible. Yes, people make friendships, but they would rather spend their lives around their families, which is going to bring me to a personal story. One of my home care workers has introduced me to now the lady that I call every time she's with her, Miss Dinah. She is one of my other home care workers' grandmothers. Miss Dinah has Parkinson's disease, and at one point her dementia had gotten so bad that she was in an institution. The doctors there said she didn't have very long to live, and her dementia would only get worse. One day they smuggled her out of the nursing home, to see her own physician, who looked at her medication charge and told them, pardon my crassness, this is fucking insane. The amount of medication they had her on was making her Parkinson's worse. So they took her off the medication, and Miss Dinah improved so much. They were able to bring Miss Dinah home. She has so much better of a quality of life. But the struggle to hire and retain home care workers became so much that her daughter had to go back to work full time just to be able to afford it. She was finally approved for more hours of home care. She does have family that can take care of her. She lives with her daughter, her partner, and the 2 kids, but it also puts a lot of stress on the family dynamic. They have to help her, obviously. It's a little uncomfortable for Jen's partner to have to help his mother-in-law shower and pull up her Depends. And her dementia is getting to the point where she feels like the family is resenting her because she needs help. And we have to tell her, no, Dinah, we help you because we love you. And that's why I call her every Monday and Friday. It was funny because my home care worker said to me after she hung up with me one day, she goes, I don't know why he likes me so much. And Lolly replied, well, it's because he understands what you're going through. He's disabled as well. And the home care is shorted. And she looked at Lolly quizzically and said, you know, maybe I should be nicer to people. And this is why I love Miss Dinah. And that's why we're here. That's why I rally. We also have a political action arm called Caring Majority Rising, where we are attempting to get as many progressive candidates elected. So if you want more information about that, I'm sure we can get you hooked up with that. We text bank, try to get as many great people elected as humanly possible. I actually got arrested for the optics of a bunch of older and disabled people trespassing during budget season because the governor's raise, actually on the debate, she said, nobody cared about these people before our administration. And our tweet was, excuse me, Governor, Caring Majority has been on this for the last 3 years. Meanwhile, she ramrodded a $1.5 billion stadium for the Buffalo Bills to be built. It's partly in the state budget. Meanwhile, home care workers, you know, might as well have been said, let them eat cake. So that's why I will continue to get arrested, hang out with Miss Loretta and Tara and the rest of the crew.
Thank you, Zach. Tara, would you like to share your experience?
Sure. So I started actually working in nursing homes when I was 18 years old. I started getting written up and threatened to be fired and have my pay withheld because I was late every night. I was getting overtime every night at my first nursing home job because I was doing bed checks for 13 residents before my shift ended, making sure that they were turned, making sure that they were changed. I had to go into a meeting with my charge nurse and my supervisors, and they said, you're the only one that's late. I said, right, because I'm the only one doing bed checks on my residents. They have sores, they have UTIs, they have wounds. My charge nurse looked me in the face and said, no one cares, it's going to be the same tomorrow. I called the state from the break room and left my job right there. And I found home care. And even though the rate of pay was lower and the benefits were crap, I could leave that job every day with my conscience and my heart, knowing that I was doing the right thing for the people that needed care. So I've worked 22 years in home care now, specifically with spinal cord injuries and traumatic brain injuries and elderly people at the end of their lives. I started, the rate of pay was $10.25 per hour 10 years ago. I'm making $2.95 more per hour now. I actually work 3 full-time jobs. My other 2 full-time jobs support me doing home care because that's how low the rate of pay is. Without those other 2 jobs, I wouldn't be able to financially do the home care that I do now. I will fight tooth and nail every single day to help people in their homes, in their communities, because we all know that they're tax-paying citizens. They are active members of their community. They are paying in, they are working, they are home owning. And fiscally, it doesn't make sense to force people into nursing homes to die. I look at a nursing home as go pick out your dying hole. Your quality of life is going to be so much better in your own home, in your own community, with your own family, your own people. I've seen family caregivers give up. I've seen the toll it takes on family caregivers. So we haven't progressed very far. $2.95 over 22 years is nothing. I have worked with other home care people who have come in and said, this is too much. I can make more at Burger King. And that's the truth. And that's sad. And during the pandemic, fast food workers were deemed essential. They were all over the TV and radio and being broadcast that these are essential workers. They're providing food. And granted, they are putting themselves out there. I'm not saying that it's not worth recognition. We are keeping your loved ones safe. We are keeping your grandmothers safe. We are keeping them protected and fed and keeping their houses clean, keeping them safe and healthy. So I think that deserves a little bit more recognition than the person giving you poison through a drive-through window. I was arrested in Albany with my client. We went to court because we couldn't do a Zoom because we were too close. When we got to the court, it wasn't even handicap accessible. We have not made very many strides. And I hate to think how many more home care aides we will lose if we can't win this fight, if we can't be seen. I will show up and I will rally and I will fight every single day. And if I have to get 5 more jobs to keep doing this, I'll do it. I'll find a way. It's heartbreaking. It's really heartbreaking.
I very much look forward to getting arrested with you again, Tara.
Thank you. I can't wait.
All right. Well, thank you, Tara, and thank you, Zach, and thank you, Loretta. I'm actually the new kid on the block at the Caring Authority. So Zach and Tara, they're the veterans there. Right. We have a little bit of time, so I was just wondering if there's any questions or comments, and it could be directed to me or any of the other guest speakers. I'm sure they'll, be happy to answer questions.
Tough crowd.
Yeah, definitely.
So
So who's
last
going
time I did the
vote
workshop, there
today?
were so many questions. I was like, okay. Oh, Loretta, were you gonna say something? You're muted.
We can always use some in-person with radio station, TV station to help people understand that is not reading our texts and or that's listening to us. Maybe we had a number of people that can get on with some reporters from CNN or Channel 1 or 7, so that this way we can try to get some more notification on how our situation is.
Loretta, we've had multiple letters to the editor published. We have had multiple interviews and articles written. My one home care worker, Lolly, beautifully put it. We were talking about home care with Dinah and whatnot, and the sentiment that yes, people in fast food definitely deserve a living wage, but her quote was, "This is a human life, not a cheeseburger," and stuff like that definitely gets put out there.
Right.
Okay. Well, if there's any questions afterwards, you're more than welcome to send me an email. Jacob, if you could put my email, or actually I'll just put it, my last name is so well. I'll put my email in the chat, and if any of the guest speakers want to put their email, they're more than welcome. But if anything, if there is a question for them specifically, you could email it to me and I could relay it to them. But yeah, I want to thank everybody for participating, and I just want to say, you know, join the caring majority if you can, and you know, spread the word about the issue. I think we've really made traction with it, but I still think we need to make this an issue that can't be ignored anymore. Oh, I see Zach put his email. So again, thank you everyone. Just last minute, does anyone have a question now?
I just want to thank everybody for coming to the Sentinel meeting. And remember, we have a video, we now have a recording of this wonderful, amazingly tender and informative workshop, which I personally will send to the same elected officials who made us aware of some of their constituents who had no home care, that were bedbound, and asked us to help. And yet those elected officials did not send anybody to today's workshop. Thank you. Our road ahead is very clear. I thank you all.
Thank you everyone. And thank you Loretta, Tara, and Zach for being willing to speak and be guest speakers and chairs here.
Well,
And
thank you,
lastly-
Joseph, for putting it together.
Lastly, to our tech, Jacob Gonzalez, thank you so much for getting us through this.
Thank you.
Yes, thank you.
Yes, thank you.
Okay,
Anytime.
bye,
Be safe.